I now hold the position of Chief Executive after 11 years with the group, and that involves all sorts of different tasks and roles, from the strategic direction of the group to the practical management and even supporting families. NPUK provides all-round support to families affected by Niemann-Pick disease, and that can be anything from attending a clinic appointment and helping them to understand the information that their clinician is telling them, to visiting them in their own home to help with practical arrangements. Perhaps they need aids and adaptations to help them in their daily life, or they are experiencing difficulties with finances and need help with benefits. We also can help children to access school. With Niemann-Pick disease, there can be many challenges in accessing school, so our staff members can ensure that children can enjoy and achieve for as long as possible.
My role as clinical nurse specialist in Niemann-Pick UK is to provide clinical advice and support to all patients and families affected by Niemann-Pick conditions. I offer practical advice, emotional support. I understand the complexities and difficulties these families face living with this condition. So I hope to provide them with the information they can make informed decisions and choices. I want to support families with their local healthcare systems to ensure they get the supports they need with their local services to ensure they have a good quality of life.
I'm the families officer, and my role is to offer families non-clinical advice and guidance. So that's anything from education, housing, family support, extended family support, employment and education. Basically my role is vast, and so families come to see me and I'll help in any way that I can. I'm quite keen to be holistic in any approach that I have, so that can be supporting families with benefit forms, with PIP assessments, which is personal independent payment assessments. I go to MDTs for them, or I can go to school reviews. I've even been to see HR to support families. So whatever the families need, I will be there on the phone, or I will be there in person, but I will make sure that I will support them in any way possible.
I am the project team leader of the Shaping Our Future Together project, which is a big lottery funded project for 5 years, starting in 2016. It is a £450,000 lottery project which allows us really to reach out to more families, arising from our last campaign, which was to Think Niemann-Pick, Think Again, and as a result of that we found more families, particularly adults, who had a Niemann-Pick disease.
I'm the Social Media and Communications Officer for NPUK. I hope to create a better online community, and so that it's easier for people to get involved on blogs and different resources which we put out, publications, and also on our social media across the board. I want more people involved, and so we can get more of a discussion going.
I'm the Finance and Administration Officer. I provide support to the board, keeping track of the grants and money that's been raised by various families, and to help them spend it wisely and keep track of things. It helps with grant applications to bring more money into the organisation.